So yeah, good morning and thank you all for joining. My name is Francis Spijk and I was diagnosed with non-small cell lung cancer in December of 2007. I was stage 1B. I had a right upper lobectomy on Christmas Eve 2007 and 4 cycles of chemotherapy in the spring of 2008. What I will be sharing with you today is based on my experience with lung cancer. You know, we all travel different paths and have different journeys, but what I want to give to you today are a few tips that have helped me tremendously during my lung cancer journey. When first diagnosed, emotionally, you will go through an initial phase that feels something like shock and fear. The initial hours and days after the lung cancer diagnosis are devastating. The shock of the diagnosis has stopped your life. The fear of death has entered your life. That fear is in very sharp focus. One of the first challenges of your diagnosis is to calm down the turmoil in your heart and mind. And I think 2 things you must do. You first have to find your most trusted ally, your caregiver. And for many of us, that is our spouse, our life partner, the one you love and trust the most. Understand that this is the person who you will lean on the most during those difficult days, weeks, and months ahead. Shake the shock and fear. There's work to do. And about your most trusted ally, sometimes that ally may not be your life partner. It could be your brother or a sister, another family member you're very close to, a best friend maybe. As long as this is a person you trust, as long as he or she understands that the challenge ahead requires strength, patience, and time. And then there's another one. It has helped me personally to understand what I was up against. And it is not for everyone, but I actually wanted to know what the 5-year survival rate for lung cancer is. It gave me a very strong sense of focus, like regardless of the statistics, I want to be one of those survivors. Go at it with that sense of urgency and stay focused. What follows? There's a lot, actually way too much information available online. And the following are some good publications. Bonnie Adario, the Lung Cancer Foundation, she has an excellent patient education handbook. Lung Cancer Alliance has a lot of shorter brochures on many lung cancer topics. And then there's the NCCN guidelines for patients that Laura already provided information on. Other than that, I recommend highly to stop surfing the web. You know, we all have a tendency to get on the web too quick. It wastes time. And mostly it saps energy, and it will not help you. Then you will eventually transition to the lung cancer treatment. You meet your medical team. You and your caregiver are the team's captains. Make sure to be your own patient advocate. You are the best one you can find. You are in charge. Make sure you trust your doctors, nurses, and nurse practitioners. If you don't like them, find others, right? Find others that you do trust. You need to feel good about your treatment as well as the people taking care of you. Don't be intimidated by all the tests that they'll throw at you. It is really all part of the process. And what my wife and I did, we started putting all our medical paperwork and test results in a binder. If anything, it gives you something to do, to research. I still have that binder. It's really very big. And yes, consider a second opinion. It may require some legwork on your part, but it can be well worth it. Then take charge, right? I say that over and over again. From weeks to a few months after diagnosis, your treatment plan will take shape and your treatments will start. Stay focused and be disciplined. It's hard sometimes, but stay focused. Trust your doctors, nurses, and nurse practitioners, and take your meds. Sometimes we all want to be heroes and say, you know, I can handle the pain. No, take your meds. Always take your meds. And lean on your caregivers. You are not alone. And then there's all treatments are challenging. You know, it's a challenging journey. After surgery, my surgeon saw me daily, and she consistently asked, "What did you do?" She never really asked, "How are you?" That's a standard question, right? She asked, "What did you do?" Remember, you are in charge. You are in charge of your journey. Take charge. You have to do. And then, the challenging side of treatment. After my first cycle of chemo, I told my wife, hey, this is okay. I can do this. And already after the second cycle, I told her I can't do this anymore. So you have to work that out. You have to work through that. It's challenging. But always remember, you are your team's captain, right? And then finally, start connecting with other lung cancer patients. It's critical. It's critical to share stories and you give to them and they give to you. It's really important that you don't isolate yourself and become your own little island. You have to share that with others. And then at the end, there's actually a silver lining. No matter where you are in your treatment plan and whichever stage your lung cancer is, make sure to start reaching out to those other lung cancer survivors through support and advocacy groups. Initially, you will mostly listen to those other patients, and as time moves on, you will speak and share your experience with others. That exchange of information is really valuable. You will learn, and they will learn, and you will meet an amazing group of people that will enrich your life. And chances are very good that you will make lifelong friends.